What happens to your erection when you do these 3 unusual exercises every day? Shocking fact. Did you know that over 50% of men over 40 report some degree of erectile dysfunction, yet only a small fraction ever do these 3 scientifically backed exercises to reverse it? Before we begin, don't forget to like, share, and subscribe if you care about male health, and drop a comment below telling us which of these methods surprised you the most. Startling question: if your erection is more dependent on blood flow than testosterone, why aren't you training your arteries like you train your muscles? Most men think sexual performance is all about libido or testosterone, but in reality, the foundation of a firm, lasting erection lies in your vascular system, especially the arteries supplying blood to your penis. Today, we're diving into 3 underused yet powerful exercises that improve sexual function dramatically. No pills, no gimmicks. These are not your average gym workouts. One of them is so uncommon, you've probably never even heard of it. But clinical studies and real-life success stories say they work, and not just for sexual health, but for confidence, stamina, and even penile size. So stick around, because by the end of this video, you'll know exactly what to do each day to reclaim your manhood. Naturally. The hidden truth about erections. Hit that like button if you've ever been misled by myths about male performance. And don't forget to subscribe so you never miss another science-backed solution. Here's the biological reality. An erection is not just about sex drive, it's about blood flow. Specifically, oxygen-rich blood must travel from your abdominal aorta through your internal iliac artery and into your internal pudendal artery, which branches into the dorsal, penile, and cavernous arteries of your penis. If these arteries are clogged, constricted, or weak, your erections will suffer, no matter how high your testosterone is. That's why drugs like tadalafil and sildenafil work. They're vasodilators, not testosterone boosters, but pills are just a temporary fix. What if you could naturally train your vascular system and pelvic muscles to perform better? Let's break down the 3 methods that can do just that. Method number 1, Kegel exercises for men, aka pelvic floor training. Surprising fact: a 2014 British study found that 75% of men with erectile dysfunction who did Kegels daily saw measurable improvements in less than 3 months. Before we go deeper, comment below if you've ever tried Kegels, or if this is new to you. And remember to share this video with any man who needs to hear this. Kegel exercises, though often associated with women, are one of the most powerful tools a man can use to improve erection quality and ejaculatory control. How it works: the pelvic floor muscles, specifically the pubococcygeus (PC) muscle, support the bladder, rectum, and sexual organs. Strengthening these muscles improves blood retention during erection and helps control ejaculation. How to do it: 1. While urinating, try to stop the stream midway. The muscles you use are your pelvic floor muscles. Contract those muscles for 5 seconds, then relax for 5 seconds. 3rd, do 3 sets of 10 reps per day. 4th, minimum duration, 6 weeks for noticeable results. Expert insight: Dr. Grace Dory, a leading physiotherapist, emphasizes that pelvic floor exercises are first-line therapy for erectile dysfunction, outperforming medication in long-term effectiveness. Method number 2, vacuumerectiondevices, VED staggering research. A 2021 meta-analysis found that combining vacuum therapy with medication increased erectile recovery rates after prostate surgery by over 70%. Before we continue, hit that like button if you're learning something new, and don't forget to subscribe for more eye-opening men's health tips. Vacuum erection devices, commonly called penile pumps, are cylindrical tools that draw blood into the penis through negative pressure. They've been used for decades in clinical erectile rehabilitation. How it works: a tube is placed over the penis. Air is pumped out, creating a vacuum. Blood is pulled into the erectile tissues. A constriction ring may be placed at the base to maintain the erection. Use with care. Start with 10 to 15-minute sessions, 2 to 3 times per week. Always follow professional guidance to avoid complications like bruising, pain, or tissue damage. Never exceed 30 minutes per session. Real-life example. John, a 52-year-old prostate cancer survivor, combined tadalafil with vacuum therapy after surgery. Within 6 months, his natural erections returned. Something his urologist said was extremely unlikely without rehab. Method number 3, penile extenders. You won't believe, studies show that penile extenders not only increase length, but also improve vascular health and erectile function when used consistently over time. Comment below if you've ever heard of penile extenders before, and don't forget to like and share to help more men discover this surprising solution. This lesser-known device applies gentle, sustained traction to the penis over time. It's not just for aesthetics. Many pelvic health experts use it as part of a penile rehabilitation protocol. Scientific support. A 2011 study published in the Journal of Sexual Medicine showed that men using penile extenders for 1 to 2 hours daily over 6 months experienced improvements in penile length, erection hardness, sexual satisfaction. Key considerations. Choose a device that fits properly and allows gradual traction. Start slowly and increase duration over weeks. Monitor for discomfort and discontinue if pain occurs. Practical tip. Combine this with Kegels and vacuum therapy for a trifecta of vascular enhancement. Final thoughts and summary. Shocking conclusion. Over 80% of men can improve erectile function without drugs, surgery, or expensive treatments if they commit to daily pelvic and vascular training. Before we wrap up, be sure to like, comment, and subscribe if today's video gave you actionable insights. And don't forget to share it with a friend who needs this info. Summary. Here's a quick recap of today's 3 powerful techniques. First, Kegel exercises. These are great for strengthening your pelvic floor muscles and improving control over ejaculation. You should do them daily. Just 3 sets a day is enough. Stick with it and you'll notice the difference. Second, vacuum pumps. These help improve blood flow to the penis and are especially useful for erection recovery, like after surgery or if you're dealing with erectile issues. Using them 2 to 3 times a week is usually recommended. And finally, penile extenders. These devices help with vascular health, can increase firmness, and may even support some size improvement. They should be worn for about 1 to 2 hours a day for best results. You don't have to rely on temporary fixes or risk dangerous side effects. With consistency, these natural methods can restore not just your erection, but your confidence, intimacy, and quality of life. Bonus tip, a 7-second daily trick. If you're serious about taking things further, check out a 100% natural solution used by thousands of men to boost erection strength in just 7 seconds a day. Simply click the pinned comment or scan the QR code on screen to watch a short video revealing how it works. It's safe, it's simple, and it could change your life. Thanks for watching. Remember, consistency builds confidence. Stick with these exercises and you'll feel the results, not just in the bedroom, but in every part of your life. Until next time, take control of your health, one step at a time.